goal, objective, etc. So let's see, third party, that's fine. You have goal, objective, etc. Instead, now you have a bigger goal, that's your larger result, then you have your objective, and then you have your intermediate results that go in between. So in the example I was just giving you, this will be like global health security, improved, enhanced. Here it will be HIV epidemic, or HIV, as a disease is controlled, what we call epidemic control. And then countries are able to respond to new pandemics like COVID or whatever may come, influenza, other things. And then you have different results. It could be a climate, climate change improved. And then you have different results on the sides. You could put this in your own organization and you have all the different results. And then they're split into multiple different ways. So really, that's kind of how results frameworks work. And you can use this instead. Instead of doing a log frame, you can do it like this. You can present it to your organization and say, this is what we're working on. This is how it looks like. And this is the results that we will form. What I like about doing it this way is that it also helps to shape how your organization looks like. So you'll have a manager in charge of access. You have a manager in charge of quality. You have a manager in charge of sustainability. You have a manager in charge of demand. You put money here, you put money here, you put money there. And if it's at a global level, you have somebody in charge of the HIV program, somebody in charge of the pandemics, somebody in charge of this, somebody in charge of training, somebody in charge of, etc. So you can have a much global view. I know Ms. Paddy did talk to us about the MDGs, and I'll touch on those. You can see the way they are structured. They're kind of structured in a different way, and they'll have different blocks. So you kind of talk in terms of the different blocks. And those are results in those blocks. And usually they'll have a person who is in charge, make sure that those results are met in those different blocks. And funding comes in those different blocks. You've got a block for this, you've got a block for this, for environment, for different areas, for sustainable growth, for economics. You've got all these different blocks. That's kind of how you structure an organization. So I hope you're able to see these differences in terms of how the results framework differs from like a log frame. Good for a small organization, good for a much global, much larger, entity. This is an example. I'm not sure why my picture got destroyed, but here I was just giving, this is from an environmental program. I see if I can even read. Okay, the first part was on livelihood security. The next part was more on policy and advocacy. The next part was on transboundary management. It's a program I worked with many moons ago. But the important thing I would like to emphasize here is that we code these components. So this is a program, had sustainable agriculture and natural resource management as the result. And then the different components also meant that we had a component manager here, a component manager there, a component manager here. And then under each one of the components, we had sections. Actually, we had a technical specialist here, a technical specialist here, a technical specialist here. Similarly, all of that. But the idea is for you to be able to describe your whole program in one place. And so that's what you're doing here with a framework. All right. Then we can talk finally about conceptual frameworks. So conceptual frameworks, usually we do them things like tree diagrams, all right, if it's at the community level. We say what causes what leads to what. Sometimes we talk about conceptual frameworks as research frameworks. There's all sorts of terminologies that come up and they come and go. Some of them have stuck around for a long time. There's something called a theory of change. Theory of change is what? It's a conceptual framework. So on my article so I got that article on monitoring and evaluation on LinkedIn. And then I think I've got 2 articles on M&E, if it's not 1 or 2. And the main comment there is, how can you talk about monitoring and evaluation without talking about the theory of change? In short, I didn't cover the frameworks in that discussion, and I did it deliberately because the frameworks are what you decide, are what makes you decide before you start to implement the program. Theory of change is a conceptual framework. Okay, so people will come up with other things, but those of us who've been around for a long time know exactly where to place them. So, and that's partly why I'm doing this first session. Is with this session, what I'm trying to do is to show you where different things fit, right? So when you see it, you will recognize it. When you see it, you will recognize that no, this is a wolf in sheep's clothing. They're just calling it a different name, but we know what it is. We know it's a logical framework. We know it's a result framework. We know it's a conceptual framework. And then what I like to do is I like to have both a conceptual framework, which is your theory of change, and then either a results framework or a log frame. Okay, so depending at a different level. So in terms of the developmental field, kind of at a higher level, we almost always have a conceptual framework. For example, we do voluntary medical male circumcision because we have a framework based on the science that if you circumcise 70% of the population, of the males in the population, it will have this percentage of an impact on reducing the number of new infections, because that has been proven, that has been studied, and we have researched. We are living in an age now, a very difficult age now, where everybody is criticizing anything that says science, anything that says data, anything that says, and there's a lot of pushback to logical thinking, to conceptual thinking. But believe you me, it's going to pass. And people will come back to say logical thinking works because if a chair is blue, a chair is blue. You cannot manufacture, change. If doing this leads to doing this, that's what it does. I remember I posted on a WhatsApp group just something simple. I like to post more scientific things. I like to post data. I still love to talk about data and how data works. I like to post. I just posted that scientists have have concluded that walking 20 minutes every day leads to ABCD health benefits. It should be logical to anybody, right? But except with this study, they were being more specific about the amount of time that people were walking. They tried people walking 5 minutes, walking 20 minutes, for 30 minutes. So I think it came down to 15 to 20 minutes as kind of a good spot of how much somebody should walk every day. I just posted something as simple as that. No, I hate anything that starts by saying scientists concluded. The scientists are right. So you can understand the anger that has come out of especially the COVID period with data and science and this kind of thinking, this conceptual kind of thinking. But that's the only way that we can explain our results. That's the only way we can explain consistently. Science is not something fishy out there. Science is the steps that it takes to get to a certain place. It's the ability for you to replicate what you said, what you're going to do. I should be able to say 20, if you work for 20 minutes in Zambia, if you work for 20 minutes in Lesotho, if you work for 20 minutes in South Africa, in Egypt, wherever, it should have the same exact benefits. And that's really what it's all about. So I hope that, we don't all go into that zone where nothing makes sense. Yes. So this is why we implement programs. So this is how conceptual frameworks look like. You have a status that you're anticipating, and you say, if we do these practices, and if we improve this, and make sure that people are using the services, we look at the individual characteristics. So we usually have community level influences. I forget the term that we use for this, but it's what's happening in the individual characteristics for them to be able to use a service. And if they continue to practice, we will get these results. And then we are able to provide these services. We have the technical capacity to provide these services. The institutional capacity are there. We look at program sustainability. All of this helps us to achieve this kind of outcome or output. So I've given you a lot of examples of kind of end game. I'll pick an example from a different field. Road accidents kills a lot of people. Okay, we want to know why a lot of people are dying from road accidents in Zambia. Practices. Is it because people are overspeeding? Is it because there's no dual carriageway from Lusaka to Ndola? Okay. Are people making sure that if we offer the services, are people making sure that they have their cars checked? The cars are, the individual characteristics. What about what people believe about accidents? If people believe that accidents are because of bad luck, for example, okay, then people are not going to wear seatbelts because they don't believe that. It's their behavior that's leading to that. Okay, do we have a RATSA to be able to enforce laws? Do we have police who are able to, can we mount whatever? Can we paint on the roads? What is it that we are doing in terms of program supply? To be able to do all those things, you need technical capacity. Do we have the technical capacity to paint the kind of right paints, to make sure the traffic lights are working and all of that? Practices is on the road, okay? Now, can we sustain it? What are we building into all of these things for us, for this to be sustainable? Or is it when the police disappear from the streets, accidents again go up? How can we ensure that we sustain it? If you can analyze your issue like this, then you can design a program that says, our program will our program will talk to people in the community to tell them that, no, if you have an accident, it doesn't mean that God intended it. It doesn't mean that it's bad mashamu. It doesn't mean that it's because your relatives, because if God who intended for people to have lots of accidents, did God just intend for the Africans to have more accidents than in Europe? Okay, that doesn't make sense, right? The reason we are having these accidents is because our roads are poor. We are not driving correctly. We are not doing the right things. We have more accidents than countries in the West. So you rationalize going through that thinking. Now, if somebody comes and say, I don't believe in that science stuff, we just need to go back to our indigenous knowledge. Because our indigenous knowledge, I'm not saying indigenous knowledge is bad. There's a lot of things. Right now where I'm here, there's a lot of aloe vera outside. Almost everything we drink, put on our faces has aloe vera on it. Where does it come from? Indigenous knowledge. But you can use your thinking to take that science and apply it broadly. Okay, so all we are saying is that there's a way to think about where problems come from and how we implement to ensure that something is done correctly. All right, so that's pretty much what conceptual frameworks are, and they can be different. It can be we have challenges at the society level. We have causes at the household level. We have immediate causes, and then these are the outcomes. In this example, we're looking at child malnutrition and the different diseases and causes and what it leads to. So those are the different things that you do to think about a problem. I talked about, some people call it a fishbone diagram. This is the head, this is the tail, these are the contributing factors. Some people say tree diagrams. These are the roots to the problem. These are the fruits. Because of this is what you achieve. These are the roots activities. This is what we hope to achieve. The reason we do this is that you can look at all of this and say, where should we invest our money as a country? Because nobody has infinite resources. Resources are finite. And so you'll be saying, we only have 10 million, 10 billion kwacha to invest. Where should we invest? Should we invest in RATSA, improve the systems? Okay. Should we invest in training people, improve the technical capacity? Should we invest in talking to people in the community, radio programs. Make sure you put your seatbelt on. This Christmas, arrive alive. I like that picture that says, this is your wife after you died from an accident. Then they show this woman smiling with another man, very happy. No, it's dealing with the individual characteristics. They don't drive. So where should we invest our resources? If we have enough resources, we can invest in all of these places or invest in different components. And usually what tends to happen is we invest in different components, but sometimes we forget the individual characteristics that lead to these practices, that lead to certain improvement that we want. All right, so I know it's already past the hour since we started, so I want to take a few minutes, drink some coffee as well, and then get some questions and get some reflections. What I'd like to get is now for us to generate some discussions, some questions, some experiences. We want to hear from people in terms of the basics for frameworks. And then we'll do the large part of, we'll take about 10 to 15 minutes break. Then we'll have a discussion, and then we'll come back and go now into the developmental frameworks themselves. I'm just looking to Zamia Secretariat. Does that work for you?
Yes, it does. So this is 15:33. So does that mean that people can come back around 13:48 or 15?
Let's just do 15:45.
Okay, no problem. So we'll have 15-minute break.
We take a 15-minute break, and then when we come back, we go into discussion, we go into review, we go into understanding. That way people can also soak it in. It's been an hour of just me giving you all the data. Let's now go into analysis, and I want to hear some experiences. And then we'll talk about developmental frameworks. All right, so 15:45.
Okay.
All right. Welcome back. Okay, so what we would like to do is spend the next 15 to 30 minutes just having some discussion, questions, clarifications, but I want to hear people's voices, what they think, what they've learned themselves. So we can also learn from other people. So I want to see who's going first. Again, Secretariat, just let me know. Otherwise,
Okay.
I'll look through the list and I'll see if I can see some familiar faces and I'll ask them to say something.
Okay. Colleagues, feel free to raise questions. You can unmute yourselves and speak up or use the chat or the WhatsApp group. And you think even YouTube and Facebook as well. But there are a few questions and comments in the chat. I don't know if you've seen those.
Yeah, I've seen those. So let me just expand this so we can see. I wasn't sure where to start from.
So,
Well, if you found a question, just tell me which one, and then I can go.
there's one on the conceptual framework. Is
Mhm.
it right? Yes, is it right to assume that an M&E conceptual framework is the same as the conceptual framework used in writing a thesis or a dissertation?
Exactly. So on one of the slides, I had put research framework. There's a bit of noise. I had put research framework. So conceptual frameworks, yes, they are similar to research frameworks. You're trying to make logical sense of your subject of study and saying, in my understanding, I'm putting forth. You're theorizing. That's why we call it the theory. You're theorizing to say, in my understanding, this is what leads to this. In my understanding, the reason why we have so many X is because of so many Ys. Okay, the reason I gave the example of accidents, the reason we have so many accidents, in my understanding, is this. So I'm going to go out there and study this. Except in a program conceptual framework, what you're saying now is that somebody has studied this and concluded that this is what leads to this. Somebody has been standing, has gone to UTH, has gone to Zambia police and studied the reasons for the accidents. And what they've discovered is that the reasons for the high death rate from accidents, what they've found out is that most of those people were not wearing seatbelts. And so I'm going to do a program based on this. So yes, you could call it a research framework. Yes, so somebody said a logic frame is the one that is also sometimes called M&E framework. So somebody else said, yes, it is. Not exactly. M&E framework. All of these are M&E frameworks, right? So you are talking about a subcategory of M&E frameworks. They are monitoring and evaluation frameworks. In this sense, what you're saying now is that this is what we use as for us to collect data, store the data, analyze the data, present the data. That's M&E, all right? So my logic framework is what I will use as my monitoring and evaluation framework. Actually, to be correct, what you call the monitoring and evaluation framework is actually your monitoring and evaluation plan. Although some people will, within the monitoring and evaluation plan, they will have something they'll call the framework. And it can be a conceptual one, it can be a logical one, it can be a result one. Yes, so it is an M&E framework. So all of those are M&E frameworks, not just the logic frame. I hope you get that clearly, okay? Mr. Kadunsa and Mr. Katebe. I can't hear anything. Oh, break time. I see. Some people went to sleep. Okay,
So
God
that
bless
was
you
really great.
too. Samipale. In the case that you reach a stalemate after you've implemented the framework, is it possible to adjust your framework to meet the results and goals based on the feedback and results obtaining after implementation? Yes, definitely. We always talk about M&E as or the M&E plan as a living document, right? So M&D plan as a living document, you should be able to adjust it as you go. You should be able to change some things and improve on them. Kindly provide from Zamia to all participants. Yes. Okay. What are some examples of strategic frameworks? Would I be right to assume that a results framework is the same as oh, yes, I didn't say that. Sorry about that. The results framework is what is known as strategic frameworks. It means the same thing. So I'll share the slides, and when you look at the slides, it says also known as results frameworks. So strategic frameworks are called results frameworks. And in a lot of cases, somebody asking about examples of strategic frameworks. In a lot of cases, when we talk about results frameworks, we start to say, actually, we talk about strategic frameworks. We start to say result 1, result 2, result 3, result 4, result whatever. And then usually we have intermediate results, sub-IRs. See people do IR 1.1.1.4. Yes. So yes, they are the same. It's one and the same. So Gabriel doing a good job to help us. When is it advisable to use a TOC? Kindly share the slides after the session. I think I touched on this already. By TOC, I believe you're not talking about table of contents, but theory of change. Okay. The theory of change is a conceptual framework, meaning that what I tend to do is always have your theory of change, because it's a mostly description, and then include one of the frameworks. I don't like to have this multiple, like I have a log frame and as well as a results framework. No, I usually will have the theory of change as my conceptual framework, which explains how everything fits together, and then use a log frame for then how we're going to deal with the problem we've described or the result we've described in the theory of change. Or use a results framework for how we are going to deal with the issue we've discussed in the theory of change. So that's kind of how that works. All right. I'm not sure if I missed any other questions, but let's go to the hands and then we can come back to the chat. Hello, can you hear me?
Yes, so we can start with Mr. Benny Kawela, and then we'll go to our Vice Chairman, Mr. Chikwampo.
Good afternoon, everyone. Thanks for this opportunity and the ongoing training. I'm relatively new to M&E plan and monitoring and evaluation things, but glad to have this opportunity. So my question is more practical, so I'll give scenarios, and I would like Ian to help in responding. So here I go. Suppose you have an initiative or a project that he's looking at creating a decision support tool for farmers, whereby this is where farmers should be able to use that decision to apply specific fertilizers on their farms. And in the whole of this program, there are different partners. So you have different partners who are implementing certain pillars of this particular program. For example, you could have maybe organization A, which is specifically mandated to deal with issues to do with soil health and fertilizer efficiency. You can have another organization that is looking at, say, Farmer Know Your Soil campaign, and many other programs that many other organizations or partner organizations that are implementing different parts of the entire project. With that example, how would one go about this M&E plan in the context of your presentation today? Thanks.
All right, good question. But now, because I know that there are others who have done this and others have done it in different contexts, I'd like to hear from some of the others. I know some of you introduced yourselves as SI advisors, etc. And then I'll summarize and then I'll add, yeah, if there's any corrections, which I think there might not be, I'll also add any kind of corrections. But I want to hear from others, a few voices. How would he go about doing an M&E plan in this context? Because we already have some hands that were supposed to talk, so I will ask that you just come off mute and speak, since we don't have anybody speaking.
Okay, thank you so much. Good afternoon, everyone. Hope you can hear me. Just confirm me.
Yes, we do.
Okay, yeah. So Rafael Chikwampu here, and thanks for the good and elaborate presentation, Ian. Maybe just two quick points. Maybe first one is a question. Someone said it is okay to use both the log frame and the theory of change in the same, document or project, if you like. I wanted a word from you on this. Is it really necessary, to use both, or one is adequate? Then the second is just a comment, as we develop these projects, frameworks and so on and so forth. For me personally, I believe in simplicity, starting with the language, It has to be very simple, easy to understand, but of course, technically adequate. Sometimes we tend to go too technical to the extent that we even confuse ourselves. Understand that sometimes even we fail to interpret it to outsiders. For a start, this is our document, but as we develop it, it's like we have another person, in mind, as if we are preparing it for them. To start with, it's our document, the owners of the document, the project. So it has to be very simple, clear, understood, but adequate, starting with ourselves, not where it's confusing even to ourselves. What more the outsiders, the potential donors, and so on and so forth. So it's just an emphasis to say we have to keep it simple, but adequate and very clear, whether we are talking logical framework, whether we're talking theory of change, and so on and so forth. Simplicity is the best in my view. I submit.
I think you're right on the money on that. Ensuring that what you do is as simple as possible and simple as straightforward as possible. There's a couple questions. I think all the three questions, including the one that just came in the chat, has to do with selecting which kind of framework should I use. Even in the agriculture example, where we are working with different farmers and different partners, you're trying to decide, which kind of framework should I use. Okay, so I'll go through kind of repeating the stages. Number one, you need a conceptual framework first. So all the time, you need a conceptual framework first. And your conceptual framework might be what you call your theory of change. You can even have a diagram there that shows how things relate to each other and how they relate to results. That's number one. With the farming program, you need a conceptual framework that says something like, if it's, I can't remember if it's a seed program, if it's a seed program, for us to be able to have these levels of yields, this is the reason why the farmers here have low yields. It's because, one, they're using the wrong type of seed for the area. They're planting at the wrong time. They're doing all these things. You describe that, and then you do your theory of change. This is what it would take for us to improve the yields by introducing this, by doing this, by ensuring sustainable whatever. That's your theory of, number one, you should always have your theory of change. You should always have let me not say a theory of change. You should always have a conceptual framework. Your conceptual framework might be your TOC, your talk, your theory of change. It doesn't always have to be. You could even have a diagram there that shows what leads to what. Okay. Now, once you have a conceptual framework, now you have a basis on which now to say, because we identified the issue here, this is where we will implement. Usually your theory of change or your conceptual framework is based on data. It's based on science. It's based on, we know that when you do this, this is what leads to this. Somebody studied, leads to this. And now you get to the second point where you now have to decide. You now have to decide and say, now, which framework should I use? Should I use a strategic framework or should I use a log frame? My simple, very straightforward way to do this is, how complex is your program? If your program is not very complex, like we talked about a farmer's program, that's all you're doing, I'll just say do a log frame. Very easy, you can see everything in one place. If your program has a lot of components, for example, in the example we gave, you have a component dealing with climate change. It's a whole different set of skills. You have a component dealing with livestock. It's a whole different kind of skill. You need vet medicine, you need other people. You have a whole component of crop production. It's a whole different component, right? So it's not just one thing. For example, if you're just doing livestock production, you just need a log frame. That's it. You're good. If you are just doing a cash transfer, it's just one set of a log frame, you are done. You're good. But if your components are multi-different teams, you require different skills, crop production, livestock, something else, I would say use a results framework because of the complexity of your program. Because then the results framework starts to help you to direct. Now, in a log frame, your indicators, so somebody says this, I'm new to this. In your log frame, your indicators are already inside the thing, right? You saw in the middle there, your indicators are already there. In a results framework, you have to do something else. You have to have an indicator framework. So you have to have an indicator, what do we call them? Somebody remind me. I do this all the time. You have to have an indicator sheet. So this is where you have all the sheets where each indicator you listed, indicator name, indicator definition, numerator, denominator, when to collect, how often to collect, who is going to collect. You have to have that included as a separate element because that's kind of how it works. Does that make sense? Oh, in case I reference sheet, excellent. Thanks for helping me. Okay, yeah. So we've got too many people who know these things. The relationship between log frame and work breakdown structure. So I talked about, first, can you explain what Mr. Stephen Ngalaso, can you explain what work breakdown structure is? I have a friend named Stephen Ngala. Can you explain what that means? Work breakdown structure. What are you preparing? What's the password? The number thing at the bottom. Okay. Any takers?
Well, I think a work breakdown structure is simply, maybe let me put it like this. Let's say you have a given activity which you need to implement. So within that same activity, there should be some sub-activities actually which build up to the full completion of that activity. So the process of breaking down that same main activity is actually the work breakdown, I should say.
Oh, okay. I see what you mean. with the log frame, because you're also going down to the activity level, you know, in our language, usually we talk about that as the work plan, right? So we like to say you've got your M&E plan, you've got your work plan, you've got your budget. Those are the three main things that we usually work with. Your M&E plan, your budget, your work plan. So after you're done with your M&E plan, now you do a work plan. It can be an annual plan, it can be 2-year plan, or it can be 6 months, whatever. Now you go into if you had a log frame, you'd go into that section that says activities. And then you will start to break those down by when. Some people break it and make it a Gantt chart. And they will say, this will be achieved by this date. Okay. And then you put in kind of in a Gantt chart format. And that helps you to see. Yeah. Does that make sense? So yes, you can relate your log frame to your Gantt chart or your work plan, or you call it work breakdown structure. Yes, there's always new terms. But like I said earlier, there will always be new terms, but the secret is for you to identify where these things fall. People will come up with all sorts of things, partly because people just like fashionable, terms. But as long as you're able to see where these things fit, you should be okay. You can work anywhere. I like to say you can implement M&E in any organization. You can work from, I used to do it in environment, went to health. It's the same principles I use. It's been so many years, I can walk into any meeting and sit down, and immediately the discussion starts. I know they're talking about data collection. This is what is required. These are the skills required. They're talking about data storage. This is what is required. This is what they're missing. So that's the whole idea of that first session, is really to put it in context so you can see kind of where different things fit. Any other questions? Or comments?
Mr. Kabuela, your hand is still up. I don't know if that's another question. Oh, I think it's okay. It doesn't.
All right. Now let me just see who is implementing, who is using a log frame in their program, and if you'd like to share a little bit about what you've done, because I haven't seen that implemented in a long time. So I want to know what kind of program you have, how large it is, and how that has worked out. Anybody using a log frame in their program? Nobody? Anybody using a results framework in their program? Okay. Let's hear from Mr. Kambi.
Good afternoon, Ian, and all the participants. Yeah, where I work, we use a results framework. And the way it is arranged more or less like a logical framework. It starts with the activities, and then we've got outputs. But at outcome level, we have a number of results, okay, a number of outcomes. But again, these outcomes are arranged in a logical order, so that one lower outcome will lead to a higher outcome. And then we have got the goal at the end. But they also combine the indicator, like the baseline, okay, the type of indicator, baseline, the target, and all this information about who is responsible to collect that information, the frequency, and then at the end we've got risks and assumptions. This is actually in water and sanitation.
Okay. Excellent. One of my best examples for for sustainable kind of actions has been out of water and sanitation area. So, and now we'll start getting into some of these global frameworks, is that internationally, if you look at, even though we like to talk about things going from bad to worse, like in health-wise, things are going from bad to worse, these things are not improving, etc. But actually, when you look at the data, this is where the science comes in. When you look at the data, things are way better now than they have ever been. There are more mothers now who are surviving birth than they have ever been. There are more children now who are surviving past their 5 years globally than they have ever been. This is what also explains to you why we have people are more comfortable to have fewer children. They have 2 kids, they are fine. Why? Because they are better able to survive. And now you can take all of that data, you can take all of that science to try and explain why things happen a certain way. And we know that the number one reason why most children were not going past their 5-year birthday, they were dying from diarrhea. And when we figured out that just by washing hands, you can save so many lives. Just by washing hands, you can save so many lives. We have seen improvements. You can look at every chart now. You can look at every chart from like 1900s or 1800s and look at the number of children who were dying under 5, who were dying postnatal. You look at the pregnant mothers, you find that it's just a simple thing of hygiene. When we were growing up, we used to wash hands in the same bucket, But from water and sanitation, we developed some models, and UNICEF, championed that. And I have some of those examples in my other presentation. And they championed that to make sure that we can, instead of all of us washing, actually you were safer just eating without washing hands than washing after 10 people, all of your uncles and aunts, everybody has washed hands in the same bucket, and then everybody goes wash there. And people are just dying from something simple, diarrhea. And there's been so much improvement. And that helps to see a global model or a global framework. And water and sanitation has been implemented globally. You can have a theory of change about this, and you can have an implementation like these kinds of programs like Mr. Kambi is talking about, where they are implementing. They're based on this theory that by ensuring that everybody washes their hands, we will see improvements in these results. You have tippy taps at the schools. You have hand sanitation basins in the homes. All of that based on what? A scientific finding. Then you have a theory of change. Now, in this program, he's gonna put a log frame, or he's going to put a results framework now that shows these are the elements that we are implementing in these categories. This is how we will measure success. I've done M&E plans for water and sanitation. What's the organization that does water and sanitation in Lusaka? I forget the name, but I've done M&E plans for them before, and go through all of these elements and say, these are the areas and this is how we'll measure the results. But it's the same principle. You do your conceptual framework, you do either a log frame or you do a results framework, and you get your results. Okay. All right. So just checking the list to see if there are any. Can people still hear me? Okay, just checking the list to see if there are any.
Yes.
Is there any other questions or any chats? Kindly share the recording. Okay. Can a framework be shared?
The question.
Go ahead.
Yes, you explained well how to go about M&A when we are dealing with the agriculture-related issues. So now, I wanted just to find out how best we can do our M&A when it comes to agriculture-related issues, like let's say seasonal crops. when we talk about, let's say, maize, wheat, then besides that, when we are doing our monitoring and the evaluation, because I'd encountered a challenge with a colleague last time when we were doing one of our M&D work, where I was told to say we don't need to go into the nitty-gritties of the financial aspect to assess their performance. So I wanted to get it from you how best we can do our agriculture monitoring and evaluation, especially like maize, wheat, those which are usually grown maybe between January and December. Then is it important to also go into the nitty-gritties of the cost implication for us to assess their performance?
Yeah, so let's start with the first question, dealing with seasonal crops. What's your goal? Let's just take wheat, for example. What's your goal with wheat?
Let's say, for instance,
what's your overall goal? It's a
yes,
seasonal
the
crop,
overall
but
goal,
what's your goal?
yes. So let's say for the overall goal, maybe they've indicated to say they want to improve they want to enhance maybe the food security in the country, maybe by growing maybe 100 and maybe 310 hectares, maybe every season. Maybe that is their overall goal.
All right. So you're talking about improving productivity, right?
Yes, yes.
Yeah. So it's the same principle. You start with, in that case, you were talking about starting with like a goal, right? So improved productivity. And the one that I showed, the example of the first, I think one of the results framework I showed was an agriculture program. We had, number one, improving productivity. Number two, we had things like indicators like the number of months that people had food in their barn, that they had the maize in their barn as kind of an indicator. That can be some of the indicators that show you whether there's improved productivity. But also how many bags they produce, right? All of that. So you start with that goal on top there. If you're using a results framework or even with the other one, you start with the one on top. And then you say, number of farmers who will have produced X amount, okay? Number of households for us who are having, I think we are using 8 to 10 months maize remaining in the barn. And that way, you know, they have become food secure. They can have 2 months maybe to struggle and get by, but at least 8 to 10 months. Then you start to use those, and then you build a framework around that. Now, coming to finances, should the monitoring and evaluation system include the financial section? No, that's not the intention. The M&E plans are designed to see the achievement of the program. I know that it gives us a lot of power, and you want to know. The only place where I bring in the finance is where we start talking about the amount of resources that are expended on a particular program. So you can do a cost-benefit analysis, for example, and that will come in the planning tomorrow. You can do a cost-benefit analysis and say, for us to achieve this, it costs us so much. We've done this, for example, with voluntary medical male circumcision and saying how much does it cost us to reach this achievement, and you can do a cost benefit analysis for different programs. You can apply it to agriculture and say for people to become food secure, we need to buy X number of inputs. How much does it cost us to ensure we grow maize compared to how much it costs us to grow cassava? You can apply it in any organization. So that's as far as usually I go. I don't go to do audits. Then you are straying into the accountants. You're straying into the accountancy role, and the accountants don't like us straying into their role. Yeah. So yeah, usually that's where you're running into problems. Yeah. Okay, anything else? We still have like 10, 15 minutes before we go into the next session. Okay. All right, I'll just monitor this for a few seconds and then we'll start. And we'll touch on some of the same areas that we've been touching on, just for context sake. All right. Okay. So what I'll try and do in the next session, and just to kind of remind us where we are at, let me just pull this up again. Okay, share. Okay. Oh, somebody had asked about can a framework be shaped in form of a monthly reporting tool? I think only as far as can you shape it as a monthly reporting tool? That's not the intention, but you can take the same outline and use it for monthly reporting. And by that, what I mean is, no, let me just put it this way. In practice, this is what helps you. So remember, if you're doing a log frame, your indicators are already in the log frame itself, and you can see them. And you could have just that one log frame updated every month. Most of us end up, dealing with large organizations, and so we end up having more like a results framework, and then you have an indicator reference sheet or an indicator reference tool. And then what you would do there is that you would take each one of those indicators and you make it into some kind of table, okay? You will update the indicator reference sheet and say, this is what we achieved this month, this is what we achieved this month. But really the best way is to convert it into a table, it's storage now. And then you start quarter 1, quarter 2, quarter 3, quarter 4. Now that's data storage skills. Hopefully one of these sessions, I can talk about, data storage and managing data storage in an organization. Because there's certain kind of skills and there's certain ways to approach this that make it easier for you to be able to do that. So as you can see, I'm going slow because I don't want to get into it. I could go very far in terms of how you set this up, how you ensure that it works well, how you normalize your data, and you're able to update it from month to month. So I wouldn't say the framework itself is the reporting tool. You kind of have to transfer that, pivot that into a tool, and then you will have every quarter, this is what we are collecting. But if your indicator reference sheet is done correctly, is the key. If you do it correctly, frequency of reporting, frequency of collection, it will be much easier for you to convert that into how often do I collect, how often do I report, how do I create dashboards out of this storage so that I can share this data very easily with others in the office. As a rule, I always create a monthly reporting, a monthly data sharing meeting for the whole office. This is where I tell people now, I'll show them. Section A, this is how well we are doing. You see, don't go into the finance people. Deal with your data here. You can also manage the program from this side. It says Section A, you've been traveling. You've been going all over the place. But look, this is what you're achieving. You don't have to tell you have been traveling, but this is the implication. You've been doing all this activity, but this is what you're achieving. Section B. At the minimum, I do every month, then larger organization every quarter, where you share a kind of outline of how the data comes together and all of that. All right. Let me just make sure, given Musonda, we'll take a couple more questions and then we'll pivot to the next session.
Thank you.
Oh,
Ian.
was it given? Go ahead.
It's given, Musonda. Thank you. I just wanted to add on the your colleague wanted to use the well, the log frame for reporting on the indicators. It's just in addition to what you said, that you can use the indicator reference sheet. You can also develop an indicator performance tracking tool from the indicator reference sheet, which will show you, or maybe if you have got indicators and that reference sheet shows you how many times this data can be collected, that indicator performance tracking sheet will now be tracking the performance of this particular indicator. If it's monthly or quarterly or semi-annually, just like that, and you'll be able to report on the performance of these indicators using this indicator performance tracking sheet. I submit.
Excellent. Right on the money. Thank you very much. So you take your indicator reference sheet, and then you have an indicator tracking tool. It's exactly yeah. So you're right on the money on that. Shadrach is responding to deciding between TOC and a problem tree analysis. All I'll tell you is, Bazungu, the theory of change and problem tree are all conceptual frameworks. Just pick one, the one that works best for you. The only slight difference in whichever one you pick is that one of them talks about the problem, what leads to the problem, the causes of the problem. Another one talks about the solutions. So some people will just start by defining the problem. You're just doing a problem definition. That's the conceptual framework. That's your theoretical framework. That's your research framework. You're just describing what the problem is, like what are the causes of the problem. And then others flip it, and that's where the theory of change comes in. You flip it, and now you're talking about what will go to the solution. So whether you call it problem tree analysis, some people will call it a fishbone analysis. Yeah, you're trying to say the tail, the head. This is what leads to this. So I'd say pick one. The important thing is that at the end of the day, within your description, it should be able to point you to which areas you're going to implement, which areas you're going to respond to. So whether you describe them as problems, these are the problems we're going to deal with, or whether you describe them as solutions, you're identifying at which inflection points will lead to the maximum results, basically. Okay, so I know these are very lengthy sessions, so let's see what we can cover in the next 30 minutes or an hour. Yeah, convert problems to solutions. Let's see what we can cover in the next 30 minutes to an hour. All right. Okay, so did I share my screen already? Or not yet? Let me just share again. All right, now we'll talk about specifically developmental frameworks. Now, like I'd said earlier, for those who came in earlier on, Ms. Paddy Sianga Newson talked to you about developmental frameworks and how they work, different kinds. What I'll do is I'll go backwards and give the context and say, this is where we started from, because that helps you to understand kind of why things work the way they do. This is the cooking of the potatoes, if you will. This will help you to understand how development works, like how things come together in the development world, why we do certain things. And then as we go into tomorrow, when we talk about planning development, we can then go to how do we then ensure that these developmental frameworks feed into our local frameworks, into our national frameworks, into what we are doing in the country. How do the ministries then respond to these developmental frameworks? But what we'll do for now is we'll just take a little bit and say, how did this come about? How did we start to do this? And why did we start to do it this way? Okay. Again, I'll go back to the African politics and the Pan-African politics that are raging right now. The reason why Pan-African politics, this is just a side thought from me, the reason why Pan-African politics are raging right now is because Africans have realized that we are at a point, it is an inflection point. We are at a point where Africa is going to rise. The population is on our side, the resources are on our side. The way the internet has functioned now to show us what's happening all around the world, that's also on our side. And so people are trying to figure out now, where do we go from here? And part of that now has come to trashing everything that has any West stamp on it, be it development, be it this, be it that. But what we should understand is when we understand where things are coming from, then we'll understand how we got here. And that helps us to know if these things start to shift, where will they go? What I'll tell you is that things that won't go away are human problems will not go away at the local level, at the global level. It's how we will deal with them at those different levels that will change. So the frameworks themselves may change and the concept may change. And that will be kind of the future of where this goes. But for now, sometimes people, even when they hear anything development, they think it's the East evil. All right. This is what we have done so far today. We talked about understanding monitoring and evaluation frameworks themselves, how they are applied, and how we implement them. Thanks for the discussion. Now we'll look at understanding developmental frameworks, and then tomorrow we'll go to the to kind of how the frameworks themselves. I'll be adding quite a number of examples and illustrations, etc., in terms of how this works at the global level. All right, understanding international developmental frameworks. There are a few things that you can highlight when you think about developmental frameworks. Number one, developmental frameworks tend to have a global focus. Okay, they tend to be at a very high level. They tend to be at a very international level. So usually that's what we see when we look at international development frameworks. They have a historical context. They just didn't show up, they have come out of certain needs, and you see the history when they've come out of a certain. It just didn't happen. Development work didn't just start to happen. It has had an historical context. There's a reason we started doing things a certain way, to a point where it became a science. You can read books by people like Andre Gunda Frank, and they describe how some of these developments have come about. There's a lot of resources now that you can look at. Yes. But the major historical context really is that we, as humans, we realized that there were some issues, some challenges that could not be solved locally. They had to be dealt with at a global level. You could not deal with some of the situations just locally. You had to deal with them at a global level. You had to function at a certain level. And when we realized that, institutions started to form that started to work at that level. So I have the list of the history. They have some guiding principles, and we'll talk about that. And then there's a way in which they work at the local context as well as at the global context. And how did we end up with these, multilaterals and, how they function at the local level? I've been a member of, when I was in Zambia, working at the PEPFAR Coordination Office, one of my jobs was multilateral coordination. So every month, every 2 weeks, I had a meeting with certain directors, PSL, and UNAIDS country rep. And then every month, we'd call a meeting for all the multilaterals. So now that's everybody, Danish, Germans, anybody doing any kind of development work. And I'll just an extra note there is we for some, I can't remember what project that was, and we were putting together funds for the government, and we had to decide on an MOU that everybody had to sign. So as a coordinating office, I was the one putting this MOU together, packaged it, we wrote it down. We listed all the countries that were supporting this particular aspect. When we took it to the Japanese refused. They said in their language, there's no such thing as a memorandum of understanding. Everything is a contract. So they refused to sign it. So we ended up having the Japanese do their own something else, because their culture, there's nothing like if I shake your hand and I tell you something. That's a contract, that's sealed. So anyway, at the multilateral level, there's a certain way that things work as well. Okay. And then we usually work with certain milestones. And so we'll go into some of that. Some of the slides are very text heavy, but I won't focus on the text. I'll focus on what's critical. Why do we have, even before we go into the definition, why do we have developmental frameworks at the international level and then they're applied locally? When you work globally, you have a platform where different countries can work together to address different challenges because you realize that human needs are the same. Dr. Kenneth Kaunda used to talk about the areas of human endeavor, okay, or the human ills. The areas are pretty much the same. You're dealing with health, you're dealing with education, you're dealing with food, you're dealing with insecurity. And those are the areas that you're almost always working around. In one of these framework things, I think I took it out of my slides. Previously, I used to have one slide that used to show the different areas. You've got shocks here, you've got assets. I hope I can find it. It's a very good slide. Maybe tomorrow I'll start with that. But this is the realization that these are the places where you're almost always working, and they are the same in every country. There are different levels in different countries, and different countries struggle with different things. But we have to start to reframe, kind of how those work. And as this discussion around Pan-Africanism evolves, we have to start reframing how those are seen and are perceived in Africa. And so that those models can start to change and how certain things are seen, They help to guide development priorities, meaning where are we going to put the money? Where should we put our resources? Okay. They help us to see how should we implement holistic development? Where do the different areas fit economically, socially, environment? Where do the different areas fit? So remember, frameworks, they can be conceptual. So these are the same things. You see what leads to what. But now at a global level, you see what leads to different things. Another key aspect that we always think about when we look at international development frameworks is inclusivity and equity. So here we are saying, how can we be more inclusive? How do we ensure that everybody is counted? Women, children, men, boys, and some of the other areas get to find themselves in a mire. Like, for example, with the gender movement, we started with, we had poor rates for girls' education. Girls were being told you get married, so you don't have to go to school. So we had early marriages, and girls go out, flunk from school because they can't go. All of those challenges. So we created things like NGOCC, okay, and Women for Change, and because of gender-based violence and all of these things to try and improve. But now we are actually at a point where there are more girls in tertiary education than boys. There are more girls finishing high school than boys. And the margin is growing, okay? So now you need to start thinking, are those models still rooted in data? Are they still rooted in science? Okay. The inclusivity and equity has to apply across the board. It's not just for girls, it should also be for boys. We were trying to balance the equation, but maybe we've put too many rocks on one side now. Now it's tipping on the other side. Okay. But that's what the science and the data is telling us. So now we have to rethink the models for inclusivity and equity. But the reason why those things happen, and countries started putting money in resources in like Women for Change, Faweza, and all of these places. It's because at a global level, the data was showing us this. I like to put it this way, at a local level. And let's say the president and the madam, they are driving down Independence Avenue or wherever. They drive down Kalingalinga It's in Osaka. The Madam First Lady sees a little girl on the roadside crying. Oh, she says, let's stop, let's stop, let's stop. Talk to the little girl. What's the problem? No, I haven't eaten. I haven't had whatever. So she commands, oh, can somebody go and deal with that little girl and make sure she gets food? When they go in the community, they find, madam, it's not just one girl. She has sisters and then there's others. The problem is very big. So she has to decide now, does she give the kid money? Or does she ensure that there's a policy that helps describe that situation and helps to say what needs to be done for that situation? Now, you can apply that principle at the global level. George Bush, I think it was about 2001, 2002, in one of the presentations as, parliamentarians, I can't remember from which, was presenting and then presented data on HIV and deaths in Africa. And he was like, is that possible that so many people are dying? And, if you remember the 90s, early 90s, every family had somebody dying. People are sick in the hospitals. Where we are here in Lesotho, instead of people saving money like into life insurance, people started saving money in funeral plans because you wanted to be buried okay. Up to now, those funeral houses, are so many of them. There's more funeral houses than insurance companies are collecting. I remember our maid used to always say, no, every time I get paid, I need to pay my insurance. Like, why are you always insisting on your insurance, on your funeral plan, instead of paying for your life insurance? But that was the situation. And people like George Bush saw that data and said, I can do something about this. Now, at the global level, what are you going to do? The minister or the first lady who has seen the problem, what is she going to do? She needs to then talk to the technical experts. They do a conceptual framework and say, this is what's causing the problem. What the first lady has done is to say, I'm going to help to make sure resources are available. But somebody who's got the technical know-how needs to go into the community and say, the reason that kid was on the street crying is because the mother is at work, there's nobody to take care of her. The reason she was on the street crying is because she has no food, she doesn't go to school, because nobody can pay for her school. Talk to the technical people. The policymakers now have to decide, okay, the education policy, we have so many children who act, it's not just that one kid, across the whole country. Now we have policymakers now who have to do that TOC now, theory of change, and say, for us to be able to do this, we need to remove all the fees for primary school so that all these kids can go to school, because we've got way too many of them. George Bush said, for us to be able to do this, I'm going to establish an emergency plan for AIDS relief, billions of dollars. Why? Because ARVs were very expensive. They were there, but they were very expensive, and nobody was manufacturing them. They were only being manufactured for a few people. Do you know that the medications that we are still drinking now, it's the same drugs, there's changes to the drugs, but it's the same drug that Magic Johnson got when he was found HIV positive back in the 80s. Was it 80s? Yeah, I think 1986 or something. Back in the 80s or 83, when Magic Johnson was found HIV positive, it's the same medication, but it was so very expensive. So in short, and why I'm taking such a long time here, it's the same theory of change. First, you identify the need and you get the data. Then you do a theory of change and say, or a conceptual framework and say, this is what it will take. They bring the technical expertise on the table, and then they start to design the program. And they say, if we do A, B, C, D, we're going to achieve the results. And what has it done? I think that's part of the reason why I've stayed in this program. It's because it's one of the most life-changing things I've ever seen. The number of lives that have been saved. There's so much money that has been spent. People have built houses and done all sorts of things. But the number of lives that have been changed through the process is still significant. We've made a difference. We've made a change. You don't see sick people the same way we used to see in the offices back in the day. because we've got medications that work. Right now, we say if somebody is taking their medications correctly, it's as good as not even being positive because you're undetectable. Life is just normal. You get other sicknesses like anybody else. But as long as you're taking the medication, life is normal. So you identify the problem, you do a conceptual framework, let the technical expertise do their thing, and they'll put all the M&D frameworks together and still make it work. It's the same way it works at the local level, the same way it works at the international level. I think that's my emphasis with all the stories that I'm telling with the president's wife. And you see, George Bush set up something at that high level. But it raises resources. There's nowhere. When I started working at Care International back in the day, I was an M&D specialist. And let me give you a little bit of my story there. So my first job as an intern, I was a student from University of Zambia, went to work at Care International. And I was, I worked around, worked with water and sanitation, worked with people in the field, worked with people at the office. And then I worked with an M&D person. Currently, he's the National AIDS Council Director General, Dr. Chibamba. And he was, young man, let's go and do some M&D exercises in the field. So we went out in the field and I noticed what I was doing because I was good in math and English was good. Those were my ones in grade 12, math and English. And I was like, this is the stuff I'm good at, math and English. There's writing, there's data. That's my thing. So he gave me M&D books and he saw my interest. I went back to Care as an M&D person. And when I went back to work at Care, and we started looking at some of the same things we're talking about. But the amount of funding we are getting at that point, okay, just give me 2 minutes. My battery seems not to be charging, not being load shaded. That's all the settings. Okay. If this goes off, because my battery is dying and I think we are in a load shedding, we'll see how far we go. I'll log in on my phone as well. And then we'll see how much we can cover. Just hold a sec. Okay. Then we'll have some discussion and then we'll see we can continue tomorrow. It's already about 16:48. Okay. So my point of what I was sharing is that at the time, we didn't get this much funding for these types of activities. We're getting around $400,000 a year, $400,000 for 5-year program, for a 4 to 5 year program. That was a lot of money for us, $400,000. Right now, we have partners whom we fund. They get $10 million per year, not 5 years, not $10 million 1 year, $5 million 1 year. They'll just chew through that money. Why? Because somebody saw an issue and they were able to raise resources and say, we can improve on something. Okay. So frameworks help with resource mobilization. Was my point. Then coordination of efforts. Obviously, we have a lot of meetings, like I shared, multilateral meetings. We work with different stakeholders, and I talk about the stakeholders in there. Then monitoring and evaluation aspect of it. That's how we measure impact. I've been so lucky to have worked in this program where data is front and center, is respected. Everybody talks data, how to manage it. But we've done things. We've done deep dives. We've done data systems, databases, all of that stuff. We've been able to measure exactly what we are doing and where, measure exactly our success. Something that a lot of programs struggle with. Like they'll start nicely, but when you come at the end of the day and say, can you say exactly whether what you did made a difference? But with these frameworks, global frameworks, we're able to measure exactly what we've achieved down to a point. We've done all sorts of things, in terms of measuring. analysis, we've done research papers, case studies, qualitative, quantitative, all sorts of things. But at the end of the day, we are able to say exactly whether we are having an impact or not. We have a metric to measure whether we are achieving epidemic control. We do it for those of you who don't work in HIV. We say, when you plot the charts, even in a country, any country, even in Zambia, we have this metric. When you plot the chart, when you see at the exact point where the number of deaths from HIV crosses the number of new infections, which means the new infections are dropping, and then they drop so far as to reach where the deaths are, then you know you have reached epidemic control. Okay, and we're able to measure that, and we're able to chart that, and we're able to say exactly when we reach that. So you're monitoring, and so the frameworks help you to be able to do monitoring and evaluation in that fashion. Okay, all right. I already talked about the way we address global challenges, etc. A lot of what we do at the global level also means that you have to use global standards. Everything works at a global level. Everything works at a much higher level. So you're always using global standards. You're always, following things at a global level. So, yeah, and everybody uses the same exact indicators. We've been able to take the same global indicators and apply them to the countries. We use the same systems like DHIS2, which is an online platform. Every country uses the same. And you're able to measure at that level because all the indicators are standard. We have a standard way of reporting on all of those, of naming things, etc. So that you are able to do because you are working from the same exact framework. Okay, so that's kind of the importance of international development frameworks. Now, because I know I'm touching on a lot of things, problems like climate change. Yes, exactly. We have problems like climate change that we deal with at that kind of level. Okay. All right. Now, after saying all of that, now I can define I can define international development frameworks. That's the definition. You will see it when you get the slides. But suffice to say, these are mostly structured plans, agreements.
Pardon us, I think Mr. Membe's power has gone off, but he said that he would be joining us using his phone. So maybe we can just wait for a few minutes for him to join us. Okay.
All right, just checking. Can people hear me?
Yes.
Yes, we can hear you.
So sorry. We are in load shedding country, and I didn't realize we were even being load shedded during the day because I drove in. We don't have load shedding in Lesotho. So just give me 2 minutes to just reset and see if I can pull this up on the other side. Just a second, few minutes. Because I'm using my phone now, So some things are not loading. All right, let's do this. Let me just talk about the beginning for the development frameworks, and then we can stop at 5, and then we can pick it up tomorrow. We'll still have our 3 hours, and then we'll finish it off. We've already covered quite a bit for development frameworks. So sorry about that. The challenges of South African power. Okay, so I was just talking about the definition of development frameworks. So there are guidelines established on global scale to address socioeconomic challenges, and usually multiple stakeholders participate. And so we had talked about some of the areas such as inclusivity, environmental sustainability, and social justice. And they can go from different areas. So most of you are familiar: healthcare, gender equality, environmental protection, poverty alleviation, education, etc. So basically just the main areas that we call the main areas of human endeavor, right? Those are the places where we have challenges. And most of what we do, we really go after the biggest problems. And all the resources come from the different, to really go after the biggest problems. But this is what you see that kind of sets them apart, is that they tend to be very comprehensive in scope. Okay, so if you look at the HIV program, for example, there's nothing left to stone. There's nothing left unturned. There's no stone left unturned. Everything is looked at, all the areas, every single area, where it starts to reducing incidence, to putting people on treatment, to anything that's related to it, tuberculosis, children, prevention of mother-to-child transmission. So they tend to be very comprehensive. They cover everything. It's the same thing when you look at agricultural programs. Okay, they cover almost every little area. They'll go through everything, all the different aspects: farmer education, seed. They'll look at planning. They'll look at rainfall patterns, etc. So that's the thing that you tend to notice about about the frameworks. And then they always push towards normative guidelines, meaning everything has to be normalized, everything has to be standardized. In our sector, in the public health, everything has to go through the World Health Organization. And we don't, small countries like Lesotho, where we have issues with, like, you don't have a lot of the big structures to decide on things. So you have to go through the standard guidance by, like, WHO. Okay, because you know that they have panels, they have groups of people who decide on these things. So basically, that's kind of what you go through when you're thinking about development frameworks at that level. And so what we'll do tomorrow, we'll have we can take a few questions, and then we'll have a little bit of an early start. Then tomorrow I'll make sure that we have, this was fully charged, but there's been no power for like the last hour. We'll make sure that we have, I will have left anyway. So what we'll do is we'll start with some of the history, and then we'll go into the planning of development frameworks and how all of that works and how we got here, and then we can have some questions. But in the meantime, in the next few minutes, let's see if there's been any reflection so far on how international development frameworks work, also having understood how M&E frameworks work. And then tomorrow, when we talk about planning, we'll link more towards how it works in country and link with the country. Is there a hand up? Okay, I thought somebody was talking. Hello? Oh, maybe just the mic is on. Okay, so far, any questions on international development frameworks?
Sorry to interrupt. Just before you went to international development frameworks, I think Frederick asked a question. I don't think you addressed it. He said, I just joined. Hello?
Okay, you broke
think
off
I
for like
was
2 minutes
muted.
and then you're back.
Yes.
Okay.
So I was saying that Frederick Pungwa, he asked a question that I don't think was addressed. He asked, he's saying, I just joined the organization I'm with, and apparently there's no tangible budget for M&E activities. I've scheduled a meeting to convince them on why I need the resources I've requested for. Are there any pointers you can help me as I meet with management? I don't think you addressed this, did you?
No, I don't think we responded to that one. I don't think I saw it. You want to convince your management that M&E is important. Yeah, it's a difficult one. So, I mean, you can present to the team to let them know. I mean, at the beginning, organizations feel like, no, we don't need to do this, we don't need to do that. What's monitoring? Just like looking around to see. Yeah, and then they start to realize just then how critical it is. Then they start to realize why when they need to have. What I'd say is, on one side, you need to kind of show the kinds of outputs that you would get from an M&E system, and show them this is the kind of thing that we will learn when we have an M&E system working. You show them the kinds of end products. We will be able to know whether our program is having impact or not. We'll be able to tell where we should put resources. We'll be able to know whether we're going in the right direction or not. All those things that at the beginning, like you need to look at the why do we do M&E. So yes, if you're able to share that. But if you want to go with something, do some analysis already and say, this is the kind of thing that we would be able to see. You see, this is our program here. This is how it looks like. No, it doesn't have a conceptual framework that helps explain this. It doesn't have this that helps explain this. We don't have an indicator worksheet that helps to show this. These kinds of things will be in place once we get our M&E system in place. Usually, we like to tell people that depending on the size of the organization, you could have at least 5%. You give them, a proposal. Most organizations use at least, some do 5 to 15% of the budget. At least 5. You could go to 10, you got 15%. Should be used for M&E, for staff, for systems, for data quality checks, for tools, for databases, for research, whatever you might want to put in there. Basically, the 4 things I talked about earlier when we started the meeting: for data collection, for data storage, for reporting. We want to be able to do these charts, madam. Sir, we want to be able to show these case studies of the beneficiaries of the program and how they have benefited. We need to be able to package this together. That's how you share why M&E is important. We need to be able to tell our donors, to show them that we are being successful. We need to be able to raise funds. How are we going to raise funds if we don't have any numbers? And to do that, it costs money. Okay. Anything else? Okay. Anything on international systems? Thank you. That's Frederick. All right. Okay. So I know we're supposed to do like 3 hours continuously, which is quite a bit. And just understanding how adults work. What we try and do now is tomorrow we will meet at the same time, and let's start on time. When we do this like for a week, we add activities and things like that. We may not get the full time to be able to do that, but tomorrow we'll go more into some of the practical side of the planning. I'll still cover some of the aspects I've covered today. Once power comes back in this Mzansi land, in this Kuvuki land, I'll I'll put down the slides and then I'll send them to the team so you can see them in advance before we have the meeting tomorrow. And that way you'll be able to reflect as we discuss. But otherwise, thank you very much for your attention and for the discussions today and all the comments and all the contributions. So for now, I'll end here. Back to you, Zamia.
Thank you very much, Mr. Membe, for your time, especially since you told us that with attending to family issues in South Africa. I think this for now. In case you've got any questions so far, please continue forwarding them. As we have promised to share the recording today and the full PowerPoint tomorrow. Mr. Member, are we able to share the PowerPoint today, or you'd rather we share everything tomorrow? So I think we'll share the PowerPoints tomorrow, but today we'll share the recording. And I'll thank you again for coming. And I also want to thank my co-host, Twatasha. She's been behind the scenes. So unless if there's anything else, we'll end here for today. Thank you very much.
Thank you all, and we'll speak again tomorrow, and keep monitoring and evaluating.
Thank you.
Bye.
Thank you very much. Bye-bye.
Is it the same time tomorrow?
Yes, it is 14:30 hours.
All right, thank you.
Bye-bye, everyone.
Just a minute.
Click on leave. Again.